Welcome back to another episode of Sports Medicine on Tap. My name is Brandon O'Line. I'm sitting at Neck of the Woods Brewing Company in Pittman, New Jersey with my good friend Dr. Frey. Good evening.
How you doing, man?
I'm doing so good. It's a great Tuesday night here at Neck of the Woods, like always. The beer's nice and cold and tasty.
Yeah.
We're here, and we're going to change gears a little bit tonight.
Yeah, we've been focusing on the NFL.
I feel like we've been NFL reporters lately. Like, we've been going pretty deep dive in NFL.
For sure.
But it's, the Championship Sunday's over. We have the Super Bowl coming up, which we'll do a Super Bowl special next week. This way we have more accurate information with injury reports, practice, and all that stuff that comes out later.
We're in that 1 week doldrum in between.
Yeah. But we had an interesting weekend in the world of the NBA.
Not a bad second.
And not a bad second. And I mean, it came almost like everything that came together for this show was kind of like simultaneously. It happened all at once, and it was just our typical late night text between the two of us of like different things. Like in that window between 7 o'clock and midnight when the prime time of sports is going on, I feel like our text traffic is probably the highest.
Sure.
And we always try to find some new things. So.
Yeah. Some surprising outcomes before we even go into the NBA. Sorry, I didn't mean some surprising outcomes in the two championship games.
Yeah, great games. I mean, we're looking into the Chiefs and Rams. Chiefs and the
Ravens.
Chiefs and the 49ers.
Well, Chiefs and the 49ers, but
Chiefs and the
Ravens.
The Ravens, correct. Was a good.
Flabbergasted.
Yeah,
I'm just flabbergasted, right?
Yeah.
Like that team is so good this year, and I know a few Ravens fans that I know, or would say like, gotta prove it, like, because they're used to seeing this. That the team is so good, and then
when playoffs when it matters, it just gets tough.
And I feel like they were there, even though they lost this game, it was just like one or two critical mistakes at the absolute wrong time. The fact that Snead was able to punch out that ball on Zay Flowers as it was going, I was like, touchdown, no way. And then also you see in
that one
very
angle, right?
clearly, right before he crosses, it goes out. And there was 3 or 4 situations like that. And
that's where that's where football's always talked about, the game of inches, right? And it's like, he was 3 to 6 inches away from crossing the plane where it would have been a touchdown.
Touchdown, yeah.
And then that would have changed the whole outcome of the game. It could have tied it up, whatever.
Yeah.
And it's very similar. I mean, both games had those couple plays where it's like, whoa, that's a big game changer. Oh, man, I don't know.
Unreal. And then Detroit, just squandering. Teams need to learn to win. And Detroit had a heck of a year. Yeah. And Laporta and Gibbs really, 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 brought that team to the next level. But I guess maybe they just don't know how to win yet.
They just didn't. The second half was tough. Yeah, and the decision making. The coach is quite the gambler a little bit. He took some questionable-ish calls.
And a few more just misses, right? Like Goff throws it to Reynolds. It's not a perfect throw, but Reynolds should have it, and he drops it. And then Goff just you get hit just as it releases.
Yeah.
And just on the cusp.
Yeah, just
so
close. Close.
Yeah. I would have loved to have seen Detroit make it. As a Steeler fan, I'm a little bit anti-Baltimore. It's just, anti-Ravens. They're the rivals. But that's a really good team. Yeah. But I would love to have seen Detroit.
I agree.
Back.
I would have liked to see that. I thought the way they came out, I was like, oh, man, this is going to be interesting. And then they just didn't hold it off. So
I couldn't believe it. But so it makes for, I almost say vanilla, yet exciting Super Bowl. Right? We got the Chiefs again. Oh, we got the Niners again. All right, let's see how it goes.
So it's a rematch of the 2020 Super Bowl, which should be interesting. Who knows what the outcome will be? So we'll see. And then, like I said earlier, we're going to keep a close eye on the news and everything that comes out prior to the Super Bowl, and we'll hopefully take a deep dive next week and kind of go through that injury report a little bit and see what's going on. And with that being said, for example, going into Championship Sunday, right after we recorded the show, it came out the injury report, and our hometown hero Isaiah Pacheco was on the injury report with a toe injury that we could have dove into a little bit.
I did not even know that.
Exactly, and I was like, ooh, I missed one. But I was like, wait a minute, the injury report comes out on Wednesdays usually, and it wasn't that reported, so I was like, all right, we recorded on Tuesday. It is what it is. And like we always said, we don't have actually access to all the stuff. We just get our best reports from different news outlets and media outlets. And
just like everybody else.
Correct.
Yeah. Public information.
So, with that being said, that means the NFL season's wrapping up. And that means it's Super Bowl time. And that brings us to a new month and going into February. last month we were telling all our listeners about our good partners and our friends over at Magic Mind. They were running a sale to help you with your New Year's resolutions and whatnot to keep focused. And we just got some inside scoop, if you will, that they're extending the sale in our promo code for another week until February 5th.
Heck yeah, baby.
So to let our listeners know a little bit about Magic Mind, we've talked
man.
about it a few times. It is a nootropic drink. It's a very small, it's almost like a little ounce or so. It's like a little shot, if you will. It's got some good nutrients, nootropics in it, and it helps with your focus. And it has a little bit of caffeine. It has some matcha tea in it, so it has a little bit of caffeine component.
Big fan of the matcha.
Oh, it's so good. And it's so hard to describe. Like, it's like one of those things you guys just got to try it. You got to try it and give it a shot, and then kind of like reflect on it. Like, I've tried a few different nootropics across my time, and I've always noticed the effects afterwards. Like, I don't really notice when you're in, but oh wow, I felt like I was on point. Like, I had things clicking, everything was like the motor was running real smooth. I got a little tune-up upstairs.
It's exactly that, a little bit of a tune-up upstairs, right? And again, we talked about it. Kind of lands in that sweet spot between making sure you have some energy so you can, have energy to do whatever it is, the project that you want to work on, get whatever accomplished. But at the same time, helps your focus, reduce some of that anxiety. It's not about this high energy, your heart's fluttering, your head's going to explode kind of a thing. It's more
and I think
focused, anxiety.
I think that's like one of the best things I like about it specifically is that there's no crash, which is the best part, which is everyone has that, that classic quote unquote 2 o'clock feeling after that first cup of coffee kind of crashes out.
Yeah.
I haven't had a crash yet, and I've taken this multiple times now, and I think I'm like 4 for 4 in the last podcast. The few shows that we've recorded, I've taken one before the show, and I feel like it just.
I do. I like drinking them.
It feels good,
and they taste pretty good.
As a benefit to our listeners, they do have a special promo. You get 1 month for free when you subscribe for 3 months at magicmind.com/JAN-MED-ON-TAP. And then you can also use our promo code MEDONTAP20 and get an additional 20% off, which gets you a grand total of 75% off your first subscription. And like I said, this deal only lasts until February 5th. So these promo codes and things like that are going to be active. So please go to the website.
Now's your chance.
Now's your chance to get it. And I tell you what, folks, you're going to notice a difference, and you're going to be super focused and get done what you got to get done.
Speaking of people who have been behind us and supporting us a little bit, pretty cool stuff about Protected, right?
Yeah, so like we mentioned, we're going to take a little dive into the NBA, and I mean, literally a couple seconds ago, I just saw on our friends from Protected on their Instagram, they had posted on their story about an NBA player who's showcasing their stuff, if you will. Bradley Beal from the Suns suffered a nasal fracture, I think within the last week or so, and he played a game on this past Sunday, I believe, with a makeshift mask. And then on Monday night, he was sporting a very nice, sleek, 3D printed black mask over his nose. And he was seen after the game and in his post-game reports by his locker or whatnot. He was saying how much better it was, how much clearer he could see, and the level of comfort he was having.
Right.
Which, I mean, when those things are on your face, like the biggest complaint I've seen with the off-the-shelf ones have always been like, I feel like my face is suffocating. It's really hot. Everything's super sweaty. I can't wait to take this thing off every chance I get.
And it's in your peripheral vision, right? Like, it's a distraction, and it's hard. If you're a basketball player, especially, right? Like to have that kind of distraction, that magnet for your eyes, so to speak. That's an issue, and actually, in the one that Beal's wearing, it looks like his nose is a little bit bigger than it probably actually is, and that's one of the beautiful things that they can do, right? Like they can. It's not just a standard off the shelf, but they can, scan your face and contour to your face, and like we need to take the pressure off of your nose, so you make it just a little bigger than your regular nose, and so your nose is recessed, it's protected underneath there, no pun intended. So then like they can make the adjustment for your personal injury, in addition to getting it to match your shape and your personal geometry exactly. They can also add extra contours to protect your personal injury. Like it's pretty amazing. It's so it's cool to see it out there yet again.
And it's awesome to see, and I think they've had some success working with the NBA and different various players, and even when we had them on, they were talking about they get their products to you in 2 days. And it's just like you can't beat that, and here we are, and he had a good game with it and everything else. So that you
And
can't beat that.
we were sponsored by them, but we're just saying this now. Like
Yeah.
this is not this
Yeah.
right here. Like this is
Yeah.
not even sponsored stuff. Like we're saying it because
Yeah,
it's
this is just
pretty
we ran
impressive what
into,
they're doing.
and we
Yeah.
were taking a deep dive in the NBA a little bit tonight. So it just kind of fit the mold of the show, and
Right.
why not throw it in when we're good friends with them, we know them, and it's like got to give them a shout out when it's warranted. Absolutely.
Spectacular. But all right, so now what are we going to talk about
So,
in the NBA tonight?
Yeah. So we're now in the NBA. A very familiar face and name, if you will, for this show, Joel Embiid, our beloved Sixers All-Star, the process, whatever you want to call.
So good.
So
But
good.
You don't need to be the guy in the show.
You don't
the
want to
focus
be
of the show more than anybody else.
You don't
in
want to
that
be
fight.
a regular on this show as a topic of discussion by any means. And ironically, we're talking about the same knee that we started this voyage of this podcast with.
Right. How about
Episode
that, man?
1.
Episode
1. Prior to my time even being involved.
That's Jason.
With Jason, yourself, and Dr. Brad Bernardini. You guys were all together, and we talked about Joel Embiid's left knee.
Right.
And here we are, a good 3 years later, just about. And we're back up
after
his left knee.
90-something or
Yeah.
other, and
Yeah.
we're talking about his knees yet again.
And so it was interesting, right? So we're not going to just solely focus on Joel Embiid. We're also going to take a little look at Julius Randle from the New York Knicks. Suffered a shoulder dislocation.
Oh, yeah.
And so kind of how the events happened with how we came up with this. I think you texted me about Julius Randle.
I was watching the game.
Yeah, during the Knicks game, he got hurt. It looked like he dislocated his shoulder. You texted me, hey, it looks like he just dislocated his shoulder. I was like, great topic.
Right.
And then within within a half hour, I would say, I was getting ready to watch the Sixers game against Denver. So it was a little later on in the evening. And I get a ping on my phone from ESPN, Joel Embiid, Tyrese Maxey, and Tobias Harris all out for the Sixers.
Oh.
And I was like, wait, what? I didn't know. Like I think I knew about Tobias. I think he was sick. Yeah. I didn't know about Tyrese Maxey. I think he hurt his ankle and whatever. But like, you looked at the show or you looked at the information, like the preview gamecast on ESPN. There was nothing about Joel Embiid on any injury report.
Right.
There was nothing. And 15, 20 minutes before the game came out, it flew off the radar, and now he's off. Right. Now he's out for the game with a knee injury And the report came out that he was warming up, and the medical staff didn't like what they saw, so they pulled him last second. So much to unpack.
For sure.
Right? Like, now I think there is a subsequent little bit of investigation from the NBA. I'm not sure if this is real or not, but they're looking into it because of the injury reporting, like miscommunication and whatnot. So that's something.
Were they hiding something?
Yeah, were they hiding it or whatever? But then it's also like, that's the world of sports medicine, right?
It
like,
is.
You can have these things happen, and we've even had it where I think, oh man, I'm almost certain that like a year or two ago, it was Kevin Durant warming up in warm-ups, and he rolled his ankle, and he was out for the game. He sprained his ankle like in warm-ups, and that's like, those weird things happen.
It happens, yeah.
But this was just like, no, he wasn't moving too good tonight. He's out, and like, as Philly fans are like, oh my God, what's wrong with him now?
Do you remember Johan Santana, pitcher from Minnesota, and then for the Mets, and it throws a perfect game, right, and then like, was it a perfect game or a no hitter? I hate to say, I don't remember. It might have been a no hitter, not even a perfect game. And Mets had not had one in their history up until that point in time, and I remember being like yeah, as a Mets fan, super excited. And I remember one of my friends texting me saying like, I hope he just like threw his arm out and ended his career. And he kind of did, sadly. And I was like, oh, dear God. Dude.
Right.
So, like, that was really kind of the end of, like, the great Johan Santana.
Yeah.
And then Joel goes for 70. And I literally had the same thought in my head, like, this can't be the same situation. He only played 3 or 4 minutes more than he would normally play. The only difference was they were passing him the ball a little more.
Right.
Like he had a point to prove. He was playing against in San Antonio.
Wemby.
Wembanyama,
Victor
yeah, exactly.
Wembanyama.
Yeah. So he's proving a point. I was like, he didn't probably. I don't think he hurt himself or damaged himself for the rest of the year or had any problems. This shouldn't be a factor. And then literally it was like the next game or 2 games. All of a sudden, he's back out again.
So it was I think it was 2 games after they played Indiana in between. And there's been some speculative reports that he may have injured this knee that they weren't in Indiana, but keep playing through it. And then I saw. So this is like, again, we don't have all the actual access. I listen to whatever they tell me on the sports channels. and there was a report that he was kind of like apparently told them, don't put me on the injury report. I'm going to play in Denver. I'm not going to do I'm not doing anything. They went to go warm up, and I guess there was some swelling in the knee.
Yeah.
And it was also reported that he couldn't even like really jump, get off the floor, couldn't move. Granted, he's 7 foot tall, but he still needs to move around, be athletic. You got to have that full range of motion, move and whatnot.
Sure.
But it's just like, oh man, this can't be good. And then so that was Saturday night. They played Portland last night, and he was also out. And the Sixers do play tonight against the Warriors in Golden State. And I don't think there's a definitive answer yet on him now. And like we always say, we record on Tuesday. It's released on Friday. So after the show, when we get home, when they play at like 10 p.m. tonight, we might see whether he comes in.
He played or he didn't play or what.
So it would be good to see him play. Because, again, there's a lot to unpack with him missing this game because, yes, it's Joel Embiid. He has a long history list of injuries.
Yeah.
But there's also this new component this year in the NBA that there's a game minimum to be in the running for MVP of the league.
Oh, yeah.
And so now that he's missed the Denver game and the Portland game, he only can miss 5 more games in this season. And if he does miss any more than 5, he's out of the MVP race.
He got it last year, though.
Yeah.
He won it last year.
He did get it last year, right.
And granted, like, I have to imagine he's a front runner for it at this point this year. Like, he's having a phenomenal season.
It's funny, like, if you look at social media and stuff, they report, like, what's going on with him and whatnot. And I guess apparently the sports books are now lowering his odds of getting it because he could be out for 5 more. And it's going to change the landscape of it.
Yeah. I hope that he doesn't risk his health going for it. Do you know what I mean?
Yeah.
And hopefully getting it last year, he'll be okay if he gets disqualified because of,
Yeah. And it's what it is now. That's just how the NBA is now. They set this new rule out. And, I mean, it makes sense. You want your MVP to have played majority of the season, which makes sense. They're the MVP of the season, not just whatever. And, I mean, he's putting on a great season as it is now.
What a phenomenal. Like, the guy's amazing.
He's putting up over a point per minute when he's on the court. He's like, it's crazy, right? Like, it just doesn't quite make sense of how good he really is. And I mean, you look at all the games when it comes to load management and stuff. He only plays like 3 quarters.
Yeah,
and then he's done for the night. Like, he usually doesn't play in the fourth quarter.
Putting up those numbers,
and he's still putting up these high point numbers and everything else. Just like And
so,
then
sorry, go ahead.
No, and then you get hit with this, and now he's out, and now it's like this loomy thing of like, oh my God, what's happening with his knee?
Yeah,
but.
That's exactly where I was going to go.
Yeah.
Back to our disclaimer and then on to that. Like, so, we've said pretty much every show. We don't have access to his actual medical records. We're not his treating physicians. We're not revealing any information about him. All we have is the same information as public information. But with that, do we have any additional information about this knee injury other than the fact that they were worried and they're not letting him play?
Yeah, so I think the main thing we got is that it was swollen. He wasn't moving too good. So functionally, he had a little bit of loss of function. And I think there was some swelling reported in the knee as well.
Yeah.
And so then it's like, okay, where did this left knee injury come from, right? Like, so then you go, again, public knowledge. You can Google Joel Embiid injury history. Just let everyone know that's what I did, how we got here. And I went way back. I mean, he's been in the league for almost 10 years now. He got drafted in 2014, which is crazy to think about because he missed those like first 2 seasons pretty much.
Navicular fracture.
Yeah. So then he came, and then he was in, and then I think he's like one of his first full seasons or so, March 2017, he had meniscus surgery on this same left knee.
Right. Do we know medial or lateral? Or?
I didn't find anything on that part. But so he had surgery on it then, and then back in April 2021, when we first started the show, episode 1, he had a left knee hyperextension and bone bruise from that wicked fall he had.
That's our first episode.
Very first episode, and here we are back again, episode 92, talking about the same knee.
I know.
So it's just questionable of like, man, is it, how do you unpack such, like, I think it's the discussion of the load management, big guys, big knees, all this stuff that we've talked about briefly, and like, it's kind of nerve-wracking to think this big guy is having knee problems, and it's like kind of sudden, unexpected, all the swelling and whatnot. It's like, how's it going to look for his future and everything else?
Episode 10 was his other knee, right?
Yeah.
Like that was the meniscus tear.
Yeah, so then episode 10. So here's just a quick history of Joel Embiid's topics of our own show. Like I mentioned, episode 1, left knee hyperextension bone bruise. Episode 10, right knee lateral meniscus tear. And then episode 71, he had a right knee LCL sprain.
I don't even remember talking about
Yeah,
that.
and it's funny. We both said the same thing, and you and I were both here talking about it. And I think it was like kind of like in their. I think it was like in a playoff game or something. He took an awkward fall.
Yeah.
And it was like
That's how it always goes.
it's
man.
always an awkward fall, and he's such a big guy. And
Yeah.
he's
14 falls a game, and every time he falls, you hold your breath.
every time. It's like,
Yeah. He got up.
He got it. And it's like, is he gimping a little? Is he a little limpy, or is he just kind of taking his time?
Or is that just Joel?
It's just Joel being a big man, getting down the court again.
Yet he's so good.
So good.
I know.
And I think what also put a lot of spotlight on this game. It was in Denver. Him and Nikola Joker playing against each other.
Yeah.
These big MVP.
Oh, everybody's waiting for that
Everybody wants
game.
to see it.
Yeah.
And we saw it in Philly. He did really good against them then.
Yeah.
And then Joel Embiid hasn't played in Denver since 2019, which has been he's afraid to play in Denver. He doesn't want to play in Denver. All this stuff. And it's like, okay, yeah, sure, but your knee will swell in Denver. Your knee will swell in Philly. Your knee will swell in Golden State. Wherever you are, it can swell up. It can happen.
Yeah.
So it's interesting and kind of nerve-wracking. Which, oh man, I hope this isn't going to be a longer issue. But it's also tough with the stretch of games like Sunday, Monday, Tuesday, or Saturday, Monday, Tuesday. 3 games in 4 days is a lot.
Yeah.
And for a big guy, and that's why NBA gets criticized about load management, other things like that. But
Sometimes they need it.
This is exactly why. Exactly.
So some speculation, I kind of wonder what the injury is. There an injury, right? Is it just swelling? And if you go through the history, he had the hyperextension injury, and watching that, going back to like I remember thinking like, oh, he just tore his ACL, and then squeaked by, right? Like, and got lucky, and there's a difference, right? Like when your knee goes back the other way like that, you tend to stretch all of the ligaments and the restraints in the back of the knee first. So it tends to be you stretch the capsule, even have like a capsule tear, and you can have bone bruising in the front of the knee at the same time. Like the end of the thigh bone and the top of the shin bone, right in the front, come together and bang together, and those two things should never meet each other unless you like something has gone wrong. And then if it's really bad, that tearing extends right across the knee, including into the ACL. But and that was our big fear. But it turned out not the case, right? And but then not too long later, another injury, torn meniscus. We tried to figure out which one it was, medial or lateral, and we know in the other knee that was like a lateral meniscus tear, right? But we don't know in this knee, right? This is the left knee, I think, the one, right?
The one that we're the one that he was out for recently is the left knee. The one with the small meniscus tear from that playoff in 2021 was his right knee.
You do start to worry. You do start to wonder. Hyperextension injury, right? Meniscus tear a little bit later. Presumably swelling and discomfort in the knee now. Like, is he going down a scary road? And he's not old by any stretch of the imagination, but for NBA standards, 29. 29, he's not a baby.
And I mean, like we said, he drafted in 2014, so he's been an NBA player for 10 years about. He's only played about eight seasons. He probably, if you tally all the games he's missed, probably about total of 7 seasons, give or take.
Right.
But still,
and
that's a lot of load and like grounded pound on those knees.
Yeah.
And he's huge. 7 feet, 280 pounds is a pretty big mammal. You know what I mean? Like, that's not a small person.
And he does. He gets beat up in this game. He gets physically bounced around like Shaq did, right? By virtue of the size, he just draws this physicality.
Yeah.
My first thought here is that it's I hate to say it, but it could be degenerative related.
Yeah.
So is it this arthritis at this point? Right. And is this going to be the new norm? Like, is his knee going to swell from time to time? Is it going to cause issues? And does he have to protect it? And is the I hate to say, but is the lifespan of that knee and the ability to play the demanding schedule of an NBA short?
Right.
Yeah.
And I think it's interesting because like that's something that's you don't get like. I think it's underappreciated, I guess would be the best way to say it, of like the health of his, just the general components of his knee, the cartilage, like you're saying, like the joint space is like, what's his meniscus, or are they fraying away a little bit from just over time, or is like the old injuries, flaring back
catching up.
Did he re-injure it? And I mean, in our field of work, when we do our injury evaluations, it always starts with a thorough history. And one of the questions is, have you ever hurt this knee before?
Right.
And
previous history.
And he, unfortunately, when you almost ask Joel Embiid about any part of his body, he's probably going to say, yeah, he's heard that before. Like it's probably been there. It's probably he's done something to it prior. So it's scary because a lot of big guys in the NBA historically, when they start having this degenerative stuff happen to their knees, it usually doesn't end too well.
Right.
And
Exactly.
we've talked about the Tracy McGrady's, the Greg Odoms, the other like bigger names have had.
Odoms was the big one.
Odom I think is probably the most popular if you pay attention. A little bit of medicine, a little bit of sport.
Sure. And that's the same thing. Once you start messing with the cartilage on the ends of the bones, right? There's two types of cartilage in the knee. You have your articular cartilage, the stuff that's on the shiny, glistening stuff at the end of the bone, which helps glide and whatnot. And then you have your kind of rubbery, fibroelastic cartilage, like kind of meniscus cartilage. And once you start having breakdown of that articular cartilage, trouble. Yeah,
trouble,
not easy to fix that.
And we've talked about, the Lonzo Ball of the cartilage transplant.
Working on it,
Landeskog from the NHL.
Right.
The cartilage transplant. So, we don't want Joel Embiid in that conversation.
Not at that size.
We don't you don't want him at that size. And so, to appreciate kind of what happens at the knee, I did a quick Google search on how to calculate force generated in your knee joint when you jump.
Yeah.
And it said that you just do a simple math equation of 6.9 or to 9 times your body weight.
Yeah.
So Joel Embiid weighs roughly 280 pounds.
Yeah.
You do a quick little multiplication. That's about 1,900 to 2,500 pounds of force going through your knee every time he jumps off the floor.
Piece of cake.
And does it, 50 times a game.
Right. And to be clear, one of the things that you just sort of alluded to, right, there's a difference between what we call a chondral defect or an osteochondral defect. So in an otherwise well-paved road, you have a pothole, right? And so presumably some of those other injuries, that's what it is. Guy has a pothole, and we're pretty good at filling the pothole, right? But if it's not a well-paved road, right? Like if you had a few knee injuries, things are starting to degenerate and wear down, and you're looking at kind of this cobblestone road where it's a little bit beat up, kind of across the board. Yeah, we got nothing. You can't like you're heading towards a knee replacement and holding off as long as you can, controlling the symptoms as long as you can. Right. You can't fix that.
Right. You don't want to see that in your face of the franchise at 29 years old. You guys, I think the whole city of Philly and everyone who supports the Sixers wants to see him for at least a few more years.
Right.
They don't want this window of his ability the process. No one wants the process to completely end.
Sure.
We want to see it succeed. We want to see it at
eventually
the end.
Succeed. Right.
Yeah. Eventually you got to succeed. Right. Like that's the hope of the Philly faithful, if you will.
Sure. And this is. Like what we're talking about right now, like this is the sky is falling sort of take on the whole situation, right? Like it could very well simply be he tweaked his knee, right? He got a little swelling in his knee, or something. He has a small little meniscus tear like he did the other time. He's gonna be back in 3 weeks, or he's gonna be back in 4 days. Like it could very, very well be that.
Yeah.
But it is a little bit concerning that they haven't released any other information, at least that we know about.
Right.
And he has this history. Yeah. Is this the beginning of that?
And to go like you said, like this is like the sky's fall. Oh my God, this is the worst case scenario.
Sure.
But like best case scenario, like basketball it doesn't get the notoriety, I guess you will, of being a contact sport. Like, they run into people. The people get run over the whole. It's very physical. Who's to say he didn't go knee to knee with somebody in the middle of a game?
Right.
Your adrenaline's pumping. You can finish that game out. But I've seen it so many times in my career where someone bangs their knee really hard in a game. Like, all right, can we push it? Can we finish? Or we'll finish this game. Okay, good. You send them back out there. They keep going. The adrenaline's pumping. Then a couple hours after that game, they are limping. They can't walk. I mean, you can kind of see, again, a bit of a drastic comparison, but like in MMA fighters, they get their legs kicked like crazy in a game, and they're still fighting. Yeah. And then you see them walk to the press conference, and they're looking like they're crippled, and they barely can walk. Yeah. And then in a couple of days, they're back on their feet, and they're moving around a little bit better. Everyone is hoping for this situation of something very minor. Yeah.
Speaking of the contact, so let's shift the conversation a little bit to Julius Randle.
Yeah. So again, the most contact, if you will, that generated an NBA game or a basketball is the charge. Right. Is offensive charging call. Right. And that kind of happened with Julius Randle in that Knicks game. He was driving the lane. He someone stopped and took a charge from him, and in the process he fell on his right arm, and immediately you saw him go down, and he was holding that thing, and you could tell he was in a lot of discomfort, a lot of pain.
Miami.
Yeah, that's right.
Dirty, rotten scoundrels. Clearly, I grew up a Knicks fan in the '90s. Like I just, hate the Heat. But they're another good team, well-coached team, right?
Yeah.
But yeah, of course, that's who Randle gets hurt against.
And so it was interesting too. Like I rewatched the video today when prep for the show, and he goes down, he holds his shoulder, and then he kind of comes out, and you can kind of see a little deformity. You kind of see that little bit of
I
boniness.
thought it was clear as day, man.
Like that, you could see like the front of his humerus was like kind of poking out. Like you could just tell his shoulder contour was just different.
That's exactly it. So if you look at the two sides, right, like you could literally see the acromion, the kind of the tip of the shoulder over here, kind of prominent, and then there's like a flattening of the contour on the side of the shoulder versus the other side, which still has like this normal like kind of curved deltoid, and that typically means the ball is slid off. Almost every time the ball slides off the socket forward, anteriorly. Occasionally it'll go posteriorly. And actually, I want to talk about that a little bit. I wasn't 100% sure by the way he fell. The fact that he had come down kind of on his arm.
Right.
I would say 90% sure it went off anteriorly. There was like a little bit of a roll as he did it, and kind of the way he was holding his arm. But the truth is, it may have gone out the back.
Yeah.
And when we talk about these particular injuries, almost every single time, the vast majority, you dislocate out the front, anterior dislocation, anterior inferior, and occasionally in a few select situations, people slide out the back.
Right.
One of those ways that you could slide out the back is if you land like this and it pushes the ball out of the back. But I don't think that was the case. I think he had just enough twist as he went down when he landed that it actually drove it out, slid it out the front.
Yeah, and you can kind of see, like, I think one of the personnel from their medical staff came out, and you can see him kind of grabbing it. And again, this is very much speculation, just because I've been in those situations. You try to reduce it kind of fast. You don't want to let everything seize up and swell and tighten up and guard, and it won't let you do it. So you can kind of tell whoever was there was trying to work on his arm, and they're like, all right, let's go in the back. And I mean, granted, it's different from college athletic trainer. I'm on a court with basketball players. I could try to do that, but I don't have millions of people watching me on national televised TV. A little different. Yeah. So
he has an X-ray machine back there.
And what's crazy is that in the article I read, he got an MRI that night.
Yeah.
Which was like
NBA.
The NBA, right? Like we always talk about how quick, and usually it's always the next day. But then I read that he got an MRI Saturday night, and I was like, oh wow, that's quick turnaround. But with that being said, you try to reduce it, and they took him in the back, and I guess I assume they reduced it in the back
I would think.
You would think, right? And then he was,
if he could tolerate it,
right?
So just like you're saying, like. Number one, when you dislocate, when the ball rolls off of the socket, sometimes it gets locked in there.
Yeah.
Sometimes you can't
correct
pop it back in. That person needs either sedation or even a surgery to open it up to get it back in. I would imagine he went back there, was in a ton of pain. They quickly shot an X-ray, make sure there was no fracture.
Right.
But it was, at least to me, watching it was pretty obvious. Like, oh, this was a dislocation.
Yeah.
But I imagine probably did the X-ray for the sake of completeness. And then oftentimes you can get that, you need the right personality. You need to be able to get that person to just calm down and relax, which is very hard to do because it's very painful.
Yeah, it's not like they're comfortable and they're just like, oh, just relax, just take a few. No, it's like their joint is dislocated, it's out of place, and their arm is on fire. It's like screaming.
Right.
And they're in a lot of pain. They can, pending, and sometimes you can get concurrent injuries with it too, like something else happens on top of it, and it's like, when it rains it pours kind of situation.
That's right, yeah.
And and I think with that being said too, like if you can get it to reduce, you double back and you make sure all nerve function and blood supply are good.
That's right.
You do a little capillary refill, make sure their hands are good and all
axillary
the blood flow,
nerve.
All that stuff's intact, because God forbid something's in the way and it pinches on the way back in, or it pinches on the way out, or got severed or something crazy. You don't check all those things.
Yeah. So that's one of the concerns, right? Like sometimes as it goes at the front, it'll kind of punch that nerve, the axillary nerve, which runs across the front there. And it can. People will have a little bit of a neuropraxia, like a neuropalsy, where it's not really quite working.
Right.
And you check, just scratch the outside of their arm and make sure that they have appropriate sensation, which is your first indication whether or not that happened.
Yeah.
As a resident, we'd be, you're on the resident, you're a resident, you're on call. Dislocation comes into the ER. Nowadays, I think a lot of the ER docs reduce it, but at that point, like they call you in, and like you may have 20 other things to do, like lined up on your schedule. So there are really two factors. The first factor is if you can get that back in without giving that person some sedation,
Right.
You've done them a favor, right? They're
Right.
not getting extra medications and sedation and whatnot.
Right.
But it's not an easy thing to do.
Right.
And two, in the back of your mind, you're like, and I got 45 other things to do here. If I can just get this done right now, this will be great, kind of a thing. Of course, you're not going to go down that road if it were worse for the patient. It really is better for the patient. So, like lots of times, like I get down to the ER, and there's a lot of coaxing and coaching, like just relax, like let your muscles go limp. I know it's uncomfortable. Just do your best and start to breathe. And you're kind of coaching them through, and you kind of put your tension on. There's 3 or 4 different reduction techniques.
Right.
A whole bunch of different things that we can do. And lots of times, like that gentle, steady pressure. If they're able to just totally relax and go limp, even though it's uncomfortable, boom, pops
Just
right back
for
in.
a quick second, and it's in there.
And then it's so much better.
Oh, and then and I think that with that too is like in the situation, so much stuff going on, but it's like just if you can relax for just not even 3 seconds and let me just get enough traction on this arm and I can let it go back in, you'll be so much more comfortable.
So much more comfortable.
Pain's not going to immediately go away.
Yeah.
It's just going to be so much more comfortable.
Yeah.
You can at least relax a little bit, and then we deal with it from there.
Right.
And then I think with that too is that I would assume this is his first time dislocator.
Right.
So it's just like
Yeah.
now I think it kind of seemed like with the reporting of like what they're doing, they're taking their time, they're trying to figure out everything, what's going to be best for them. They're probably going to try a conservative approach first.
So I saw reports. They did do an MRI of his knee, and they're reporting no structural damage. Right.
Yeah.
And so what they mean by that is that so there's 2 acronyms that the general guidelines. The first sort of crossroad in the treatment, the management of this. The first one is AMBRI, which is more of a multi-directional, so flexible hyperlaxity, kind of a loosey-goosey person, and they have instability that goes in different directions, anterior and posterior, maybe inferior, and lots of times you treat that physical therapy, and you're a little less aggressive about it.
Right.
And then you have TUBS, traumatic, unilateral, so it goes in one direction, or unidirectional, and then Bankart is the B part of that. And a Bankart tear is a tear of the labrum, a very common standard one. As the ball goes out the front of the socket, down on the bottom, it tends to knock off the labrum, which is the rubber gasket. Not really rubber, but it looks a lot like rubber. That goes around it, and it tends to knock off that rubber gasket, cause a tear in the rubber gasket. So traumatic unidirectional Bankart lesion or Bankart tear, and then surgical. Oftentimes we treat those surgically. But the reports are no surgery. For Julius.
Which is good. It's a good sign. You kind of want to hear that. And just now, what they have to do is they just got to strengthen his shoulder, make it really stable, make it really strong. I mean, we'll see. So I think it's just that he'll be out multiple weeks. They kind of already nixed him out of the All-Star game, which is going to be February 18th. They said if he gets selected to the All-Star game, he won't be playing. So that's at least almost 3 weeks from now. So he's about.
That's kind of your standard answer.
Give or take 3 to 4 weeks, he'll be out. So now we just wait and see if he comes back with maybe a little brace on or something. Maybe.
Right.
Who knows what they'll have? I mean, they have access to everything.
Sure.
They'll be able to maybe put
Sully
put him
brace.
in, Sully brace or something like that. Just a little protection. Not so common in basketball.
Sure,
but
it makes it tougher, but he's a lefty.
Right. So which is interesting is that he hurt his right shoulder, but he's a left-handed shooter. So luckily that arm doesn't do so much in the regards of scoring and shooting. I mean, I'm sure he still does layups with that hand. He can still dunk the ball, whatever the case is. But,
catching the ball, just general play.
Right. But it does make a significant difference when it's not your shooting hand because there's a lot more stuff that you do with that hand. It's probably his primary dribble hand and other things like that. So he doesn't have to worry about that part.
Right.
But still important.
Still important.
Very important because in basketball you need both of them. You need to play defense. You got to have your arms up and other things like that.
Right.
And you don't want this to become a chronic issue either, because then he got, like you said, the first report came back no significant damage after the MRI.
Right.
Great for the first time, right? Like that's what you want to see. You don't want to go down the road of having all these additional things, the Bankart lesions and the labrum tears, and then you play with the game of surgery. But then, hopefully, he can stay stable enough and be good, and then we don't have to run into that issue.
So I mean, you hit the nail on the head, right? Like so. Now, they skip steps, and which I generally personally I always think that's a bad idea. Do it the same way every time. That's how you don't miss anything. But nevertheless, in the NBA, doing it the same way every time doesn't include an MRI that night. That's just not realistic. It's just not how it happens.
Right.
But in reality, normally you would get X-rays, and that's kind of your 3 standard views: an X-ray kind of from the front, from the side, and then we would call an axillary view from the
Mm-hmm.
bottom, and to make sure that you've gotten the ball back on the socket,
Right.
the golf ball back on the golf tee. But then also additionally frequently when we're just doing our x-rays, there are two other views, and this would be more for like the residents out there or
Right.
the docs out there. There's something called a striker view where sometimes you can do it with the arm up like this, which is a very uncomfortable position for someone
Right.
just to look at the shoulder. But that helps you see something called a Hill-Sachs lesion, a dent on the ball. And then there's also something called a West Point view, which is similar to our axillary view, could be tolerated a little bit better. It's kind of this like shot through this x-ray through kind of your shoulder joint when you have her not quite up like this, but more of this kind of saluting position to help really see the glenoid. Did you knock a piece of the bone off? And the reason I'm starting to go down this road a little bit is you could ask the question, why is his management so different than, let's say, Ja Morant, right? Like Ja Morant just had shoulder instability, a dislocation, getting surgery, season's over. Here we are, and it's totally different management.
Yep.
Julius Randle, non-operative, put him in a sling. Usually it's like 7 to 10 days in a sling, get him out of the sling, do some physical therapy, get back out there, buddy.
Yep.
So how can it be so different? And really what you get down to is how stable is the shoulder. And and we don't know Ja Morant's situation. We don't know if they knocked off a piece of bone, but I worry either he's had multiple dislocations
Right.
or when he dislocated, not only did the labral tear, but it actually cracked a piece of the bone
Right.
of the socket off. So it would be the equivalent of trying to put a golf ball on a broken golf tee.
Right.
You
Fall off every time
Falls
almost.
off every time. Yeah. You can use the same golf tee over and over until the part of the lip breaks,
Right.
and then you're trying to balance it and it just rolls off.
Yep.
So I wonder. Fortunately for Randall, clearly that's not happened if they're trying to get him back.
Right.
I wonder if that's what happened to Ja Morant.
Yeah. Yeah, I think it's an interesting take with recent NBA news, like you're saying with the Ja Morant situation. I think it's like one of the things, just time will tell. We'll see what happens with Randall.
Yeah.
He's having a good year, and he's a good player.
His numbers, 25, 26 points, 9 assists, 9 rebounds, 5 assists per game. Like, he was Kentucky. I'm pretty sure, right? Kentucky, not Kansas. I'm pretty sure it was Kentucky.
Yeah.
He was really good in college. And I don't know if it's I just lost track, but I didn't feel like he was as good in the NBA as he
away,
was in
right.
college until like 2 or 3 years ago. And then it was like, oh man, remember this guy? He was amazing.
Yeah.
And now he's been great again.
Yeah, I think it's definitely as of recently. Yeah, so Kentucky. You said Kentucky.
Kentucky,
right?
yeah. I was pretty sure it was
double
Kentucky.
checked you for you.
Thank you.
But yeah, definitely Kentucky. And no, and I agree with you. Like, you didn't really know too much about him. Like,
Yeah.
I didn't. But the last couple years, he's been making a difference. He's put a name for him. And I think it's interesting, too, is that the Knicks just traded R.J. Barrett away, who was another young star that they took a little early in the draft.
Right.
And they traded him. They got
Yeah.
O.G. Anobi. I always butcher his name.
Yeah.
Who also is recently out with some elbow inflammation, which is another topic for a different day. But, just that management of different things. That's what happens in this world of the NBA, right? There's 80-some plus games in a short amount of time. And it's just like, when you're in the thick of the basketball season, it's a lot on the body. It's a lot of wear and tear. It's a lot up and down on the court, a lot on the knees, a lot on the joints. And then when you add all this upper extremity stuff, it's just like, you got to do something. You got to manage it somehow. You got to take a couple days off. You got to do this. And that's what happens in both of these cases of, like, Joel Embiid. They go out there, they watch him warm up. He looks like crap. Sometimes in our world, we have to protect our athletes and our patients from themselves, because they just are in denial. Like, no, I'm fine. No, I can do it.
That's
like,
why we're stealing helmets on the sideline.
Yeah. Like, how many times? Like, no. Listen here. He, she, whoever you're dealing with. Like, no, you can't do this. You can't keep going. You're gonna make it worse. And that's where we come in and we have to put our foot down. Like, look, and that's what they did in Philly.
Yeah.
And that's what
this is in your best interest.
Yeah, this is in your best interest.
Right now.
Whether you might, I understand this scenario. Joel Embiid going against Jokic in Denver. It's a big deal. But you look like crap, man. Like,
The bottom line is,
right, and
we
then,
want you.
Right, we want you to play, and then we don't want to put you out there with an inability to bend and flex your knee. Right, it's swollen. You can't land very well. You can't jump.
Yeah.
You're going to be a shell of yourself. And then you're doing that, and your body's going to move differently. Then you're going to tweak your ankle real bad, or something else is going to happen, and you just go blow up the kinetic chain, and it's not going to be good.
Yeah. Presumably, given the fact that the report on that MRI was that there was no structural damage.
Right.
Presumably, what they mean by that is that there was no labral tear.
Right.
And it's the ball slid out. Whether or not there's a little dent on the back of the ball or not. And that if I get into that, I'm going to lose everybody. Like, there's a whole big thing. presumably there was no labral tear. You know, and you know, I'll do a little bit on it, right? Like, so there are people sometimes. Let's say you dislocated your shoulder, you got an MRI, and there are these acronyms on there. You don't know what it means: a haggle or a glad or an alpha. So sometimes it's not just a torn labrum. You can have a torn labrum and it pulls off a piece of cartilage. That would be what we call a glad region. Glenoid labroid articular defect. So it pulls off a piece. Sometimes people will get something called an alpsa lesion. The labrum in the front tears, and as it peels back, it also peels up periosteum. That's the key. And it peels up on the front of the socket, peels up away some of that, and then these tend to be like worse. So there's something called a haggle lesion, humeral avulsion, the glenohumeral ligament. Yeah, and so the tearing doesn't happen on the socket side; it happens on the other side, on the ball side of the ball and socket joint. So the capsule tears off of the ball, and to be honest, one, they're a little bit harder to fix, and then two, they tend to portend worse outcomes. That person tends to be more unstable with those particular injuries than they are even with the labral tears. With Julius, presumably, he doesn't have any of those things. No structural injury. Still, I hate to say this, the re-dislocation rate, it's pretty high. Yeah. Once it's happened once, it's pretty high.
It's like, I forget, when I was a student at Temple getting my doctorate, I forget the guest speaker, but it was an ortho surgeon, and he was like, anytime someone dislocates, surgery immediately. He was very...
I think that's the wrong approach.
Right, like, but he took the approach of first time dislocated, get it fixed right away. You don't have to deal with it anymore.
So this has been kind of defined. Right. It is a little bit controversial.
Right.
So the dislocation rate for the re-dislocation rate for somebody under the age of 20 is in the 90s. It's pretty high. Yeah. And then the other factors there, right? So we have something called, we look for generalized ligamentous laxity. And there's a scoring scale, Baton scale, and you check your scoring scale. And if you're generally ligamentous lax, it's another risk factor that you're going to dislocate again, pretty much if you don't fix or you don't undergo surgery to tighten it up. But then there are other factors. If you're male, that's a higher effect. And if you play a contact sport, then that's another risk factor. So the truth is, I would say, under the age of 20 to 25, male, contact sport, first-time dislocator, yes, maybe. Yes, maybe. Even without the labral tear.
Right.
Especially with the labral tear. So then, yes, maybe. But otherwise, first-time dislocators, he doesn't fit that category.
Right.
You don't fix that automatically.
Right.
And it's just not the right answer.
Right.
And it has been defined. And people will sway it this way, one way or the other. And to be honest with you, I used to sway more towards the conservative. And the pendulum for me has swung a little bit where I've become a little more aggressive. Because you see multiple dislocations can eventually cause other problems.
Right. And I think that's the thing. Is like when you become... I've had a basketball athlete in my career that has had that. He had one dislocation, and it was okay. We rehabbed it really well, and he was good for about 6 months to a year.
Right.
Then it happened again, and that window of 6 months to a year kept getting shorter to 3 months.
Right.
Then it kept getting to 1 month. Then
That's
it was
right.
every other week or every time, and then it became
He did
like,
it when he's sleeping. Yeah.
Then it was like, oh, I don't even try to dunk the ball with my left hand anymore. I can't do it. Well, now you're a shell of yourself.
Right.
Now we have to get it fixed because you need to do that. And it was to the point where where my athlete he couldn't get his arm past about like midway, like 90 degrees. He couldn't like really defend. Like in basketball, you have to have your arms all over the place. Right. If you have one arm that's down the whole time, you're not going to be effective.
You're not doing very well. Yeah.
And that's where you run the risk of that chronic dislocation recurrence all the time.
And then when you need surgery, now you're going to a bony procedure.
Right. And it's
as opposed to a soft tissue procedure. The outcomes aren't as good.
Right. So I mean, it'll be interesting. But I think, like you said, with that, the no significant damage report from the MRI is good news. I think if you're a Knicks fan, if you're a Knicks fan, you don't know too much about the stuff that we talk about or whatever. But we're telling you, that should be good news.
Yeah.
And they usually report pretty accurate stuff. They can withhold whatever information they want, but
they don't put false information.
Right. No structural damage or no significant damage is a good sign. In that give it a couple of weeks, let them get really strong, and let him get back out there and maybe some protective devices or whatever the case is, and see how he does.
What's your prediction, your estimation, timeline wise? And again, it's always tricky. What's your estimation?
I would say I think they're on par for like they're nixing out the All-Star game of the 18th. I think by the end of February we see him again.
Yeah.
And I think it'll be just in time to get enough momentum to get him back in the swing of things, get his feet back under him, and then hopefully they can make things interesting and hopefully
they're playing well.
They're playing well, and I hope they're probably going to gear them up to get to make a playoff push or whatever the case whatever their case is. And I think they'll have him. And and I think also with that being said, I think the load on that shoulder isn't going to be as significant as it would be if it were his dominant hand.
Sure. Yeah. My estimate was going to be 3 to 4 weeks, and I think if you wait until after the All-Star break, it's probably right around 4 weeks. Yeah. So my gut is sometime shortly thereafter, unless they're playing really well. If they're winning without him, right? Then all of a sudden maybe they say, you know what, maybe we take 5 or 6 weeks, because that extra time, it isn't going to hurt. Right.
And I think similar to a couple weeks ago when we discussed about the Christian McCaffrey thing with the bye week that they had.
Oh, right.
But the All-Star break is going to help them.
For sure.
That's a little bit of time with
Buy
no
an
games.
Extra week or so.
Buy an extra week of time to heal. So it's like timing of the injury is never good. But silver lining, you have an extra week in the schedule that's going to be open up time for everyone else to get healthy and everything else. And he's going to be in that boat of he's going to be rehabbing, doing all that stuff. So you get without time loss, like you're not losing. So I don't know how many. Say he's going to lose 10 games.
Yeah.
And that's with the All-Star break in between. If there's no All-Star break, maybe it would have been 12 to 15 games. Exactly. So.
Yeah.
Bright side of things.
The timing of this was a heck of a lot better than right after the All-Star break.
Correct. Yeah. If it happened, or even in the All-Star,
in
the All-Star game, that could have even been worse. That would have been. Never want to see that happen.
Who was it? Do you remember one of the running backs tore his, I think his ACL? Like a really good running back in the
Pro Bowl?
In the Pro Bowl. Before the Pro Bowl became a shell of itself. or I think they were doing it like beach football or something crazy like that. I don't remember who it was. Oh, gosh. It was a good running back. I don't know. Whatever. Anyway.
Either way. I think we'll see. And I think both of these injuries are going to be interesting. Philly fan base, New York fan base, they're all kind of going to keep their eyes on it.
For sure.
And I just looked during the show. It's about almost 8 p.m. Eastern time now. Game time for the Sixers is in about 2 hours, and Joel Embiid still listed as a game time decision. So we don't know. Yeah. We'll see. And it'll be funny. We'll go home and put the game on, and we'll find out whether he's in or not.
Sure.
And we'll see. And then if he misses tonight, then he's down to 4 games that he can miss. And if he doesn't get the MVP, as a Sixers fan, if he doesn't get the MVP and they make a push in the playoffs, I'm okay with that.
100%.
I don't care about that MVP.
Far better.
He needs to hoist a different trophy, in my opinion. So we'll see.
Yeah. That's exactly. I hope he doesn't. That's the one downside of that rule, right? They're going to push guys to push themselves and risk injury because they want to chase that. That impacts their next contract. That impacts their careers. That impacts their legacy.
Yeah.
Right. Like in maybe they're not making the best choice health-wise.
Yeah.
But so I hope he has the wherewithal and the team has the wherewithal to say, it'd be great for you to win another one. You just won it last year. This is not the reason to go back.
Right.
Let's make sure you're healthy.
Yeah. And I thought also totally a little bit off topic, but in regards to the NBA, last time we talked about the NBA and we talked about Joel Embiid dropping 70 points and how rare it was. It only happened about 6 or 7 times, and 3 of those times were in the last so many. Crazy. And then a week later, Luka Doncic scored 73, I believe, points. And it was just unbelievable.
Of course.
Like wow. Another 70-point game just kind of happened.
Here we go.
Here we go again. Unbelievable where the game's going now and all these young stars. It's just, there's a lot of people who've been retired lately who are all those good guys. And now we got a new slew of all these young All-Stars coming up.
Right.
And
I'm really excited to see what Wembanyama can do one day. That guy can play, man.
And I think he had a formidable showing of going against the reigning MVP, 10-year vet versus the rookie. And when he got 70 put on him from Embiid. Granted, it wasn't directly on him exactly, but in that game.
I feel like he has to put on a few pounds. He's just going to get pushed around.
And I think, it's funny. You see, I saw some things on the internet of just comparing big guys from then and now. You see pictures of Shaq when he was a rookie. He was still a pretty big guy. He was big. Then you show a picture of, the guy like Chet Holmgren or, Victor Wembanyama. They're very skinny people.
Yeah.
They're so big.
Yeah.
And Joel Embiid wasn't as big as he is now as when he came in the league.
When he was coming out. Yeah, no,
so
of course.
You would have hoped the same trajectory for him, for all, the Victor Wembanyama's and all those guys that they just trust the process, not even just because of Embiid, but their process of in San Antonio with their strength and conditioning staff, their training staff.
Right.
Get them real big, get them real strong, and hopefully have another career and be someone of a Tim Duncan or someone else in this person.
Because he seems like he can do it all, man. He seems like one of those players.
And he's big. He's a big guy.
No.
Yeah.
Oh man.
So I think that's all we got for tonight. We're going to go ahead and wrap up and close out our tab here at Neck of the Woods. And before we go, we just give another shout out to our sponsors. Like we mentioned before in the beginning of the show, Magic Mind is extending the promos that they give to our listeners for an extra couple days till February 5th. So go to magicmind.com/JAN Med on Tap to get 1 month for free when you're subscribing for 3 months. And then you can also use our promo code MEDONTAP20, get additional 20% off, which gets you a grand total of 75% off. And this, again, only lasts till February 5th, 2024. So go ahead and get out there and get your brain super focused and get out there and crush your goals. Again, we'll mention our friends at Protected, a custom 3D printing bracing company that allows sports medicine professionals to have unprecedented access to 3D technology. Using a quick 3D scan of your with an iPhone app, you can get a custom fitting brace that arrives in as little as 48 hours. Protected is a tool that should be in every athletic trainer's toolbox. Learn more by heading to their website, www.protect3d.io, or download their app Protected in the App Store. The Energy Lab, the region's premier sports performance center and destination, located here in Pittman, New Jersey, at the Total Turf Experience. Neck of the Woods Brewing Company. Sourfest, May 18th, 2024. Folks, if you want to taste what Neck of Woods is all about, you go to Sourfest and you see what happens when Frank is back there concocting up the craziest solutions and all these different magic things. And to say that, quick little piece about that, Frank made a great blackberry sour last week.
We talked about it.
They put it on tap on Tuesday, and it sold out by Friday. Our show wasn't even posted yet, and it was gone. And then lastly, Timberreal Productions helping us put together this show on all our platforms. Social media, YouTube, Instagram. If you're out there, please give us a follow and a subscription. We appreciate it. Everyone have a great night. Stay safe, and we'll see you next time.